So I'm really honored to be here today. I just got off a plane and got here just in time.
We heard you almost missed it.
I almost missed it, but I'm really thankful to be here, and it's great to see a lot of new faces in the audience. Rick has been a supporter of my work at Rock Health and the work of our startups since the beginning, and have really enjoyed working with Qualcomm Life. And it's been really exciting to see how you guys have evolved and grown in the 2 years as a startup within a larger organization. So maybe we can just start with talking about TueNet and some of the other exciting things that have happened over the past 6 months to a year at Qualcomm.
So I've actually been at Qualcomm for just over 2.5 years now. And when I came there, Qualcomm had spent, gosh, close to a decade promoting the concept of bringing wireless technology into healthcare, but we'd yet to develop any sort of commercial offering and launch a product. But my background is as an entrepreneur, and I was tasked with putting together a business plan and building a business in the wireless health space, where we actually did a year ago at the mHealth Summit. We launched the TueNet platform and the TueNet Hub. And basically what we're doing is that we are mobilizing healthcare. We're not creating new health solutions. What we're doing is that we're mobilizing health solutions that our customers are creating. So we've developed this device that has multiple near-field radios in it that connects with a medical device in a home very easily. The guide that you get when you take it home is plug it in. And it pairs up with the medical device. It sends the data automatically to the back end. And that data then is sent to where our customer needs it to go so that they can help manage the care of their patient or the family member maybe that they're taking care of. So this is one product, the TueNet Hub, but we're also building other gateways to get data to the back end. We work with a number of companies that embed technology directly. So for example, a glucometer, Telcare is one of our portfolio companies that we've invested in. And they have cellular actually in their glucometer itself. So it's like a cell phone, a glucometer that's a cell phone. But so we launched TueNet, and we're building that out. We've got over 200 partners now that are at some stage of integrating with the platform. We also launched the Qualcomm Life Fund, and we've got a $100 million fund targeted at wireless health investments, digital health investments. And some of you might have seen the recent Rock Health report. Just came out 2 days ago?
Yesterday.
Yesterday.
Yeah.
And it mentioned the investments made in the space actually are up 45%, which I think is pretty good. The numbers are relatively small still, but hey, it's a very early stage market. It's a highly complex market. It's a very risky proposition with all the regulatory issues and so forth. So I think a 45% year-over-year growth is pretty darn good, and I think 1.5 billion roughly is pretty good. But I also think that it's pretty good.
Rick. That's
What's
not
that?
small.
That's not small.
That's not small.
I also think that it's pretty cool that Qualcomm Life Fund led the charge in terms of the number of investments that we made in 2012. Thanks for the
and Jack
promotion,
Young, who is part of the Qualcomm Life Fund, actually won the most prolific investor. And that is a very objective award. He literally led the most investments in the space.
I understand he won the most, or the best dressed too.
Best dressed too, yeah. Well, so now that you know a little bit more about us, we're curious to know kind of who's in the room today, and if we have any entrepreneurs, people working on innovations in the senior care space that want to be in the space, that are in the wrong room. I don't know. Great. So one of the facts that I found when digging this up, I mean, we work in digital health in general. Obviously, we want lots of our startups to tap into this really important market. But one of the things that I found was interesting is that 10,000 people turn 65 each day in the US, and 80% of them live with one or more chronic diseases. So this is 13% of our population in the US, but they consume 40% of our healthcare spending. So as an industry, what does this mean for us? As people that are working at the intersection of healthcare and technology, what does this mean in terms of the opportunities for disruption?
Well, I think in healthcare, and particularly in what we call elder care right now, we've got a sustainability problem in the same way that we've got a sustainability problem with our climate or with fuel. We can't sustain what we're doing today with the rate of growth. That 10,000 that 10,000 number, 10,000 people per day turning 65, what that's going to amount to in 20 years is a doubling of the number of seniors, 80% of which have a chronic disease. And today, those folks are consuming roughly 40% of healthcare spend. So you can see where it's going, where the trajectory is if we don't do something about it. So we've got a problem that we have no option but to solve. It's a broader healthcare problem, but it's particularly acute in this specific area. The good news is that that's when I think the innovation community, and that's when entrepreneurs, and that's when sort of American ingenuity comes into play. And I know that we've got the capacity to solve it, and we're well underway. I saw some of the raised hands in here, people, some of you I know who are underway and already working on the problem and making good progress already.
So I was debating saying this, but you are closer to being a senior than I am. So
you know, when I was first invited to the Silver Summit, I thought to myself, what does that mean? What are they trying to say? And then I looked and I thought, that's okay, I'm not really a senior, but it says 50 and over. I'm 50, so I guess I am. I'm both a doctor and a patient.
So what do people your age want to What does the senior community need? Are these unique solutions that need to be created to address unique problems, or is it just an extension of solutions that are already out there targeted towards different populations that need to be modified?
It's a combination of both. I think I would start off by saying that I said earlier when I was describing it, it's what we call elder care. I think we've got a branding problem in the space, frankly, because who wants to be cared for? Who wants to be monitored? You know, we saw the guys with the cars here. Maybe you want to monitor a car, but who wants to think that someone is actually monitoring them? I think we need to focus more on empowerment. You know, it's more about empowering people to live better lives, to live at home longer, to be more well, but on their time and on their schedule and in their environment. So first and foremost, I think we just need to focus on the quality of life issues and also focusing on the right problem. But in terms of the health issues, they're mostly dealing with chronic disease. Obviously, they're getting, they've been dealing with them longer, and they're getting more severe as they age, and that's why the greater cost. But they're the same types of problems that we're dealing with. They just have to be presented in different ways. I saw a session two or three sessions ago on gaming with seniors and how engaged they are once they do embrace it. It takes maybe a little bit. It's a bigger hill to climb to get to the point of actually sitting down with a game console. But once they do, they tend to stay on and play, engage in these activities even for a longer period of time than younger folks. So there are ways that we can motivate them to, I think, engage in managing their own health and taking more control and using the types of solutions that we're talking about here today.
And who pays for that? Is that
That's
something
a big
that they're
challenge.
paying out of pocket? Is it being reimbursed?
That's a huge problem, obviously. It's a problem that you folks who are entrepreneurs are all dealing with, and the business models associated with these. I think today the obvious answer is that typically the children of these seniors are paying for it. Maybe Medicaid is paying for some of it, but or they're paying for it themselves. But I think, again, over time that can change. We're seeing with more and more experience with people like Joe Kvedar here in the audience, who's actually working in the space, who's got solutions that are out there. He's proving results. He's proving the value and the cost savings associated with these types of solutions that eventually we will get reimbursement. And I think that's obviously the point at which we will see a lot more growth, more rapid adoption.
So one of the things you said earlier was around kind of the aging in place, people wanting to stay at home and having perhaps home health, sensors, telemedicine, this area of technology that enables people to be monitored while being empowered.
Yeah.
What does that market look like? How big is this market? Who are some of the dominant players? I know it's been hard for people to scale. Maybe you can talk a little bit about the challenges scaling there.
Yeah, it's actually, elder care is probably the oldest form of telehealth, right? Back to the PERS, I've fallen and I can't get up, those miserable commercials that you saw late at night. that are still on, I think, today. And the call centers associated with that, which is really what those were all about, is people having someone to connect with. But there's a tremendous amount of new innovation, particularly around wireless solutions that are a little bit more freeing, if you will. They're obviously providing a lot more mobility. And in terms of leaders, these folks probably know who the bigger players are that are providing those solutions. I'm actually particularly more interested in sort of the early stage companies that are starting to shake things up. We actually made a recent investment in from the Qualcomm Life Fund in a company by the name of ClearCare. And ClearCare, to me, they're basically creating workflow, and they sell what would be sort of like an ERP system for elder empowerment, we'll call it, to the companies that provide those solutions. And so it's everything from billing to customer engagement to all sorts of different workflows. So they're sort of laying the tracks, if you will, for others to provide services on top. There's also a great company in San Diego by the name of Independa. And
they just received funding too.
They just received $12 million. Yeah, big funding. And so Independa is creating the solution in the home. They've got an integrated solution that's connected with multiple medical devices, with the TV. It's got its own monitor as well that provides engagement with family members and pictures and so forth. Just a whole range of capabilities, if you will, in this solution. So that's more the train. The problem that we have in this space in general is that there's been a lot of trains built without the tracks, and that's actually very typical of an early stage industry, of a market that's changing like this, this fast at this stage. It's not that unusual, but we need more track laying, and so we need the infrastructure laid down first, and that's a big part of what we're trying to do at Qualcomm Life, is really trying to put the pieces in place that people can build their offerings on top of.
So instead of trying to go after the very fragmented home care nursing facilities, you're trying to enable developers to build products that integrate with your tool, and you are directly distributing to those consumers.
Absolutely. So we're trying to become the wireless health network. We're trying to create a new network, a new wireless network, if you will. We want to become like a new carrier, leveraging other carriers. We work with all the operators here domestically and internationally that's secure. We've also gone to the extent of making TueNet and all of its elements FDA listed. It's a Class 1 MDDS device, so it can pair with other devices, Class 1, 2, or 3, without them having to go back through another FDA approval cycle. So our goal is not to provide the end clinical solution. It's not to provide the end service to a senior citizen or to a patient. It's really just to sort of lay that foundation, the tracks, if you will.
Yeah. And how big, let's talk numbers, how big do you guys project this market to be in 1 year, 5 years?
Well,
or at least like as big as what other market? Yeah,
well, we're working within the largest industry on earth. So it's a $2.7 trillion industry here and close to a $5 trillion industry globally. And I have the interesting challenge and opportunity. I'm a startup guy. That's my background, and I'm doing a startup within this massively successful, very big, very profitable company. And so I don't have a choice to build something small. I got to build something big, or it's irrelevant. So the good news is they've entrusted me to do that, and they believe that as well. And this is clearly, I mean, it all depends on how you break it out and what pieces and parts, but we expect my business, Qualcomm Life, which is separately incorporated from Qualcomm, we fully believe that we'll be the sort of the third leg of the stool for Qualcomm. We've got our chip business, we've got our licensing business, and we think healthcare. And I believe, and if you listen to Paul Jacobs in his keynote, and you listen to him speak in other cases, you'll hear him talk a lot about healthcare and wireless playing a big role in that. We firmly believe that it's going to be a multi-billion-dollar industry, and that our business alone, just that infrastructure piece of it, is going to be a $1 billion-plus business.
So going back to the 13% of people that are making up 60% of the cost, how much of that 60%, well, we know we're not going to get it down to 13% of costs, but how much of the 60% do you think we can adjust because it's inefficiencies or just waste that technology can kind of come in and eliminate?
Well, the interesting thing is that there's been a whole bunch of studies done already, and again, people like Joe Kvedar have direct experience in telehealth, in M-health, in remote monitoring or remote care in general. And actually, we've got a customer of ours that was awarded a very large contract to provide care management for a number of patients with chronic disease in Italy. And in single-payer systems, they have the opportunity to, they've got much more data, right, than we do. We have to cobble it all together. In a single-payer system, they provide the care and they control all the data. So they have a real good ability to measure what it currently costs to care for a chronic disease patient and what the offset might be if they do something different. And so they've awarded a contract to our customer Telbios in Italy to provide this care management for these patients, and there's an element of M-health as well. And they expect close to a 30% reduction in the cost. And there's a number of studies that have shown 20 to 25% reduction in cost, reduced bed stays, improved mortality rates, and so lots of opportunity here, lots of.
Yeah, one of our startups, Podimetrics, is working on the bath mat that can detect foot ulcers earlier, so it doesn't end up, progressing into something that would cause an amputation. And that's really directly geared towards the Medicare and Medicaid patients and getting that reimbursed. So speaking of the government, do we have anyone here from HHS or ONC, FD, anybody from the government?
Oh, good.
All right, let's talk about.
Now we can talk about them.
We're going to talk about them. Let's talk about the good, the bad, and the ugly. So there's been a lot of change with Obamacare and a lot of change within the FDA and the mobile health regulation guidelines draft. What do you think in 2012, so the past year, was the best thing to come out of the government in terms of supporting innovation? What was something or something that didn't happen that might be kind of hampering innovation?
Well, I think probably the best and the worst thing that happened was the Affordable Care Act itself. I think the Affordable Care Act is my personal view, and it's not my political view, it's just in terms of now it's the law of the land. What does it mean? In a lot of ways, it means more complexity and more cost, but I think it's also going to spur an enormous amount of innovation, because what I like about it, and actually what I like about what CMS is doing now as well with their innovation center and their innovation awards, they've got $2 billion that they're awarding to companies that come up with creative solutions that improve the quality of care while at the same time reducing the cost. That they're doing both a carrot and a stick, and I think that's also what's gone on in the Affordable Care Act, where you've got things like this, the Innovation Awards, where they're awarding people real dollars to create solutions that improve this problem that we were just talking about. But at the same time, there's some real penalties that are being applied. The readmissions issue, of course, the 30-day readmissions issue, where these hospitals started in October being penalized if their readmissions rates were too high. So that two-sided approach, also the hospital-acquired conditions, that penalty associated with if you show up in a hospital and you end up getting something you didn't walk in there with, the hospitals aren't going to get reimbursed for for curing you or for taking care of you for something they gave you. So those types of stick approaches along with the carrot, I think, are going to make a positive difference. But again, the complexity associated with the Obamacare and also just the political nature of Obamacare, and what that does also that makes it hard is that it introduces a lot more confusion with investors and a lot more risk, and so I worry about it slowing the pace of innovation as a result of that. But again, I'm very optimistic in our ability to innovate our way out of this. I think it's going to take a combination of, the innovators are, I think, a real critical part of this, but historically, particularly in healthcare, healthcare hasn't been very interested in talking to the innovators. They've heard from them before. And
the changing of the guards now.
What's that?
It's the changing of the guards.
It's a big change of the guards right now. But I think it's going to take a combination of both, though. So we need healthcare to embrace the innovators. And again, we don't have a choice. We're going broke right now at the pace that we're moving at in terms of the cost of care. So we've got to deal with the problem.
Yeah. Well, and we always say at Rock Health, healthcare, no one has a monopoly of wisdom on how to fix the healthcare system. And unfortunately, it is universal. We all have health. We all will age,
Yep.
Hopefully. And so it is a problem that I think is fair that everybody is able to participate in and contribute their expertise and experience, whether they're a designer trying to better the experience of an elderly person using an app on their iPad to manage their caloric intake, or whether that's a hardware designer helping you guys build the TueNet platform. There's really room for everyone in healthcare.
Yeah, one of the things that I think entrepreneurs, innovators get knocked for, and it's probably legit in some cases, but you think about the typical Silicon Valley entrepreneur that might be going through Rock Health. Do they have any sense of what a senior is going through, and how can they build solutions that are really going to matter? And I'm actually very interested in your perspective on that, because you see a lot of it.
Well, empathy is really hard to teach, but I think there are great schools of thought. IDEO, for instance, the secret sauce of their design and design thinking is really around empathy and doing enough work with the potential users that you can really truly understand their needs. So it's not in individual thinking they know all the answers. It's really trying to explore and find the answers from others. But I think a lot of the things that we see at Rock Health are from individuals' own experiences. So whether that's someone living, exactly, or someone living. We've had people come through Rock Health that are living with chronic diseases that have inspired their work, and I think everybody has the sense of a greater purpose, and that's what's really special about healthcare, is that not only is it a really great market business opportunity, but you also have a sense of doing good in the world.
Yeah.
And we always try to, Rock Health itself is a nonprofit, so we are very cognizant of our impact on health outcomes and reducing costs, but we also, they're saying we only have 2 minutes.
Should we offer a question?
So yeah, let's open up for a few questions. Only good ones.
Only easy ones.
In the back.
You talk a lot about entrepreneurialism. What advice would you have for entrepreneurs?
Stick with it. It's not going to be easy.
Yeah.
You're going to have a lot of sleepless nights. It's going to be tough on your family. Love your wife or your husband if you're. It's really a hard thing to do, and particularly in an industry like this where it's so, there's so many different constituents, and then you've got the regulatory piece and you've got the legislative piece. It's not going to be easy, but it's worth it. I mean, we're attacking the biggest problem on earth right now. And it's one that really matters to all of us and all of our families, so keep with it.
So, innovation in healthcare. Okay, by the way, let me ask first, anyone here from Humana? Good. So last year I went to HIMSS, which is the big health technology fair, to give a keynote on a project that we did with Humana where we built a virtual world for them, for their Medicare seniors.
Yeah.
Okay. And after about 2 months, with almost no advertising, we had 7,000 users. They took it down right? Because it turns out they weren't so sure they really wanted to be in the user-supported healthcare business.
Huh.
Okay, so that's one point. Second point, at HIMSS, I looked for any evidence whatsoever that humans were using social networks as a way to get medical information, and there was none. There was one corner of the room, there was someone actually with a piece of paper had put up social networking, and there were 10 people sitting out front of Starbucks at a table.
So are you suggesting that HIMSS was not embracing those companies who are, or are you suggesting it doesn't exist?
The interesting thing is there seems to be an enormous disconnect. I mean, I work in the education world as well. Okay, I mean, I run Yville, which is a site that has 7 million kids on it, virtual world for education. There's a huge disconnect between the educational world and what kids are really doing. I think there's a bigger disconnect between the healthcare industry and what people are really doing on the internet.
I think you're absolutely right.
And my question is, how does that, I mean, does Obamacare change that by turning the healthcare industry into the auto insurance industry, which is, I think, where it's headed? Or how does that, what breaks this up so that they catch up with what's already happening?
Yeah.
So we work with a large payer. We work with United, but we obviously have talked to and had different arrangements with other insurers because they, for better or worse, play a very important role. But I think what they're seeing, they're going to have to start competing on quality now. I mean, things are absolutely changing, and with the health insurance exchanges, they are going to have to be competing on something a little bit more than what they are competing on right now. And so they're kind of turning to organizations like Rock Health and the entrepreneurs that we work with to see how they can innovate and provide better services and think of themselves as actually a consumer product, because they are a consumer product.
And I'll go back to what I started with, and that is that it's not optional. Like I said, it's a sustainability issue. We have no choice. We have to change what we're doing. We can't sustain the way that we deliver care today, the quality of care that's delivered, the dollars that are spent to deliver care for the people that we have today, and we're growing and getting sicker and getting fatter. So we've got to find ways, and I think we will.
Well, I'm a biologist too, so I can also tell you there is something known as extinction. So there is always,
well, that's an option, I guess, but it's not the one I'm not voting for that one.
There is always the option you screw up and you don't survive.
Maybe that's what happened to the dinosaurs. Maybe they
So thank you, Hallie and Rick. Great discussion.
Thanks for having
very
us.
much.